prevention strategies for ventilator-associated pneumonia, hand hygiene and infection control measures. You've heard it before, but it's worth repeating: wash your hands. Seriously, it's one of the simplest and most effective ways to prevent infections like VAP. Healthcare workers need to be diligent about hand hygiene and follow infection control measures to keep those pesky bacteria at bay. So, be sure to give them some hand sanitizer applause next time you see them. Oral care and subglottic suctioning. Taking care of your mouth might not be the sexiest of tasks, but it can make a big difference in preventing VAP. Regular oral care, like brushing or swabbing the mouth, can help reduce the amount of bacteria that could potentially make its way into your lungs. Subglottic suctioning, which helps clear out secretions from the area just above your vocal cords. Ventilator bundle and daily interruption of sedation. Time to bundle up, ventilator style. A ventilator bundle is a set of practices that hospitals use to reduce the risk of VAP. It includes things like elevating the head of the bed, using special tubes that help prevent microaspiration, and regularly assessing the need for continued sedation. And speaking of sedation, daily interruption of sedation can help wake patients up and assess their readiness to breathe on their own. Take a breath. Stay clean, keep those lungs happy, and remember to always wash your hands. Treatment options for ventilator-associated pneumonia. Antibiotic therapy. When it comes to treating ventilator-associated pneumonia, antibiotics are the superheroes of the medical world. These powerful drugs target the bacteria causing the infection and help to kick them to the curb. However, not all antibiotics are created equal. Doctors will need to consider various factors, such as the patient's medical history and any potential drug allergies, before prescribing the appropriate antibiotics. So, don't be surprised if your doctor becomes the Sherlock Holmes of antibiotics to find the perfect match for your infection. Supportive care and ventilator management. While antibiotics fight the infection, supportive care and ventilator management pick up the slack to help you recover. This includes things like providing oxygen therapy, monitoring vital signs, and ensuring adequate nutrition. It's like having a team of cheerleaders on your side, rooting for your lungs to get back in the game. Surgical interventions. In some cases, ventilator-associated pneumonia may require a little more than antibiotics and supportive care. Enter surgical intervention. These can include procedures like draining abscesses or removing infected lung tissue. It's like having a SWAT team of surgeons swoop in to eliminate pockets of infection. Complications and prognosis of ventilator-associated pneumonia. Ventilator-associated pneumonia has a knack for stirring up trouble, especially if you already have underlying health conditions. Secondary infections and multi-drug resistant organisms. If ventilator-associated pneumonia wasn't enough of a headache, it can also pave the way for other infections to crash the party. These opportunistic invaders, known as secondary infections, are like the party crashers who arrive uninvited and wreak havoc. To make matters worse, some of these uninvited guests may be multi-drug resistant organisms, making them harder to treat. Impact on mortality and morbidity. Let's not sugarcoat it, ventilator-associated pneumonia can be a serious business. It's like the ultimate test of survival in the microbial world. In some cases, the infection can lead to increased mortality and morbidity rates. But fear not, for modern medicine is always evolving and finding ways to improve outcomes. Future directions in ventilator-associated pneumonia research. Novel preventive strategies. Prevention is always better than cure. That's why researchers are constantly on the lookout for new ways to keep ventilator-associated pneumonia at bay. From developing vaccines to implementing infection control measures, they're like superheroes trying to outsmart the villain. So, don't be surprised if one day we have a caped crusader swooping in to save the day and prevent ventilator-associated pneumonia altogether. Advancements in diagnostic techniques. And when it comes to diagnosing ventilator-associated pneumonia, the more information, the better. That's why scientists are working tirelessly to advance diagnostic techniques. With improvements in diagnostic tools, doctors will have a better chance of starting treatment early and nipping pneumonia in the bud. Exploration of targeted therapies. That's why researchers are diving into the world of targeted therapies for ventilator-associated pneumonia. By identifying specific targets within the bacteria, they hope to develop more effective and tailored treatments. With these advancements, we may one day have a whole arsenal of weapons to combat ventilator-associated pneumonia. In conclusion, ventilator-associated pneumonia is a serious complication that can arise in patients requiring mechanical ventilation. It is important for healthcare providers to be aware of the risk factors, clinical presentation, and preventive measures to effectively manage and reduce the incidence of VAP. Early diagnosis and appropriate treatment are crucial for improving patient outcomes and reducing the burden of this nosocomial infection. With ongoing research and advancements in preventive strategies and treatment options, the future holds promise for further reducing the impact of VAP. By prioritizing infection control and implementing evidence-based practices, healthcare providers can strive towards minimizing the occurrence of VAP and improving patient care in the critical care setting. Thanks for watching.